Welcome to this video, which is part of a series of trainings offered by the Midwest Center for School Mental Health. Our series offers guidance for developing and implementing effective school-based mental health systems. My name is Dr. Cheryl Holm-Hansen, and I serve as co-director for the Midwest Center. In this training, I will share some general guidance for how to measure the impact of school-based mental health services. Recent years have seen a growing awareness of the mental health and well-being of children and adolescents. Nationally, 1 in 5 children and adolescents are estimated to have a diagnosable mental health disorder, such as depression, anxiety, or attention deficit disorder. Many communities have seen increases in recent years in the number of children or youth describing feelings of sadness, hopelessness, and stress. While mental health services can be offered in a variety of settings, we know that school mental health services are especially important. Children and youth receive mental health care in schools more frequently than in any other setting, including doctor's offices or mental health clinics. Mental health can close gaps in access for historically underserved populations, such as youth who identify as Black, Indigenous, or people of color. Access to high-quality, school-based services can help improve student mental health and academic success, while also improving school climate and safety. But how do you know how well services are working in your school? A critical component of a comprehensive approach to school mental health is to measure your impact and to use that information to guide continuous quality improvement efforts. First, I will briefly describe 3 frameworks that provide a context for the content that follows. Second, I will provide an introduction to impact, describing what it can include and how it is different from other types of information that may help inform your school mental health services. Third, I'll offer some suggestions for getting started in selecting impact measures and developing a plan to gather this information. After that, I'll outline some suggestions for how to share your impact information with key partners and how to use it as part of a continuous quality improvement process. Throughout the video, I'll share some best practice recommendations as well as guidance for ensuring that your impact measurement supports school or district efforts related to equity. The content of this training video was designed to align with 3 guiding frameworks promoted by the National Center for School Mental Health and the National Center for Safe and Supportive Schools. Together, these frameworks highlight the required components of a comprehensive school mental health system, along with some of the guiding values that drive the ways school mental health systems are designed and implemented. The first guiding framework is the Comprehensive School Mental Health Model. Comprehensive school mental health systems provide a full array of supports and services that promote positive school climate, social emotional learning, mental health, and well-being, while reducing the prevalence and severity of mental illness. Comprehensive systems are built on a strong foundation of district and school professionals, including administrators, educators, and specialized instructional support personnel, in strategic partnership with students, families, and community health and mental health partners. Comprehensive systems assess and address the social and environmental factors that influence education and mental health. The Comprehensive School Mental Health Framework, developed by the National Center for School Mental Health, provides best practice guidance for developing and implementing school mental health systems. Recommendations are provided for 7 core elements. Teaming addresses the need for multidisciplinary approaches for designing and implementing mental health services. Needs assessment and resource mapping are used to identify the most pressing mental health needs of students and the available school or community services that could help address those needs. Screening is used to proactively identify and refer students who may benefit from mental health supports. Services are provided at multiple levels or tiers. Tier 1 services refer to universal strategies that can be used to promote mental well-being of all students and build healthy school climates. Tier 2 services refer to early intervention services offered to students who may have emerging concerns or who may be at risk of developing concerns. Tier 3 services refer to the more intensive interventions offered to students with identified mental health needs. Funding and sustainability strategies are integrated into the system to ensure that needed services can be provided and sustained over time. And finally, a comprehensive school mental health system should include a strategy for measuring the impact of your services and using impact information to continuously strengthen services, inform policies, and change systems. The second guiding framework is the culturally responsive, anti-racist, and equitable, or CARE, schools model. In a culturally responsive school, students, families, and educators' cultural references are included in all aspects of schooling, including supports and services that promote well-being and mental health. Policies and practices promote equity and oppose racism and other forms of oppression. Equitable schools provide the climate and resources that enable all students and educators to perform at their highest level. Culturally responsive and equitable schools embrace cultural differences and assets, use cultural knowledge to promote well-being and academic success, mediate power imbalances based on cultural identities, and work to dismantle systems of injustice. There are three distinct elements of this model. First, effective school mental health services should incorporate cultural responsiveness, ensuring that services and supports reflect the cultural beliefs and values of students, families, and educators. Second, school-based mental health systems should actively and intentionally oppose racism and other forms of oppression. And third, school-based mental health systems should be used in service of equity, ensuring that every student has what they need to achieve academically and experience positive well-being. These values cut across all aspects of the comprehensive mental health system. We will see how these values relate to impact evaluation as we consider whose perspectives are being reflected, what questions are being asked, and how information is used to promote more equitable systems. The third and final defining framework for this presentation is the trauma-informed schools model. Trauma-informed schools are based on an understanding of trauma and how trauma impacts students, families, and staff. It's also founded on the belief that healing happens in safe, authentic, and positive relationships. Trauma-informed schools ensure emotional and physical safety, view students holistically, support choice, control, and empowerment for students, staff, and families, and strive for cultural competence. Again, we would love to see these values driving your school-based mental health impact evaluation as we think about measuring what's important within a school system and thinking about how we offer choice and empowerment for students and others in driving that impact evaluation. There are many different kinds of information that you can collect to shape and inform your school-based mental health system, but they are not all impacts. You may collect information, for example, about student needs or available services to help you select the right interventions. You might explore the ways that services are being offered in an attempt to identify strategies to improve implementation or fidelity. These are important, but they're not impacts. Impact refers specifically to the long-term effects or changes that occur as a result of a program, practice, or policies implemented within your comprehensive school mental health system. There are a variety of impacts that we might expect from school-based services. For example, we might expect to see educational impact for students, such as improved grades, higher testing, or teacher retention. We might also expect to see improved emotional health or well-being for students. Third, we may see benefits in terms of school climate, such as improved relationships between staff and students, reduced violence, or increased sense of safety. Fourth, there may be financial impacts, such as cost savings related to expenditures on staffing or services, or reducing potential outcomes like dropouts or suspensions. Finally, we may see equity-related impacts, such as reduction in health or education disparities, or the development of more equitable services, systems, or policies. You do not necessarily have to measure all of these impacts, but it may be helpful to measure several different kinds of potential impacts of the work that's happening in the schools. There are a variety of reasons why it can be helpful and important to measure impact data. First, impact data provides the opportunity for you to look at the services and supports that are being offered and to determine what is working well, but also where there is room for improvement. Second, your impact measurement system can provide ways for diverse groups of students and parents to describe ways that they have experienced services and how they may have found the services to be beneficial. Measuring impact is a necessary step in efforts to promote a more equitable school-based mental health system. Impact measures should help you identify potential disparities in service implementation or outcomes and inform strategies for promoting equity in your services. Impact data provides information that can inform continuous quality improvement. For example, if the implementation of Tier 2 school mental health services results in improved educational functioning for students, but staff describe increased burdens of implementing these services, it may call for maintenance of the Tier 2 services while improving paperwork efficiencies or offering more support to staff. Fifth, impact data can provide you with information to support your efforts to advocate to sustain or to grow your school-based mental health system. Finally, disseminating the results of your impact assessment can be an important step in promoting transparency, information sharing, and relationship building with your community partners. It's easy enough to say that we should measure impact of school-based mental health services, but how do we get started? How do we know what are the right impacts to measure, and how should we measure them? In the next section of this video, we'll recommend some starting points for making these decisions. A good starting point is to describe your theory of change. When you're implementing school-based mental health services, it's important to have a clear theory about how you expect these services to lead to school or student impacts. Your theory of change can help you explain why you use the approaches you have selected at each tier and why you expect these interventions to be effective. To answer these questions, it helps to have a concise and accurate way to explain what you do, what you expect to happen, and how it should lead to the intended results or benefits. This description is your underlying program theory. A program theory provides a logical and reasonable explanation of how and why an intervention is supposed to work. Spelling out the theory can be one of the most important things that you do for the success of your intervention. A clear program theory helps others make sense of your intervention and helps you make sure you're implementing something that has the best possible chance of success. A clear program theory also makes it easier to choose the most appropriate results to measure. Your impact measurement will not be useful to you if you measure the wrong outcomes or if it's based on faulty assumptions. For example, you may not be able to reasonably expect changes in school climate if you are only providing Tier 3 interventions to students with identified mental health concerns. Program theories can often be captured in a series of if-then statements. If something is carried out, then something should change. Between the if and the then, there should be solid evidence or some well-established connection supporting the idea that your intervention will work. A program theory should spell out why you expect the changes to happen. Make sure that your theory is not only clear and makes sense on paper, but that it is based on good underlying evidence about what promotes well-being for students. Evidence can be based on previous work experience, literature and research, professional opinions from colleagues and national organizations, and input from the communities that you are serving. Let's review a few simple theories of change. First, Imagine that you are in a school that has seen disproportionalities in academic success, including graduation rates, for high school students from a Hispanic or Latino background. Through a needs assessment, you discover that there has been a growing tendency for these students to be experiencing high levels of anxiety, which has contributed to increasing levels of absenteeism. You decide to offer culturally grounded Tier 3 services for these students. You may have a theory of change like this. First, if you provide effective services to these students, then they will identify effective strategies for managing their anxiety at school. If they use these strategies, we would hope to see reduced anxiety and higher levels of school attendance. If they attend school more regularly, we would hope to see improved academic performance, including reducing those disproportionalities that were your initial concerns. Here's a different model. Your school may be developing interventions to support teachers or other school staff who are experiencing high levels of stress. You decide to offer a series of supports for staff, including increased prep time, additional support in managing classroom behavior, and self-care resources. As a result of these interventions, you hope to see reduced teacher stress and burnout. This is a positive impact on its own, but you may also expect to see subsequent impacts for students. For instance, your theory may be that if they are less stressed, teachers will be more positively engaged in teaching, which should improve the relationships and connections between the students and teachers. Reduced stress may also help teachers implement more effective strategies for managing student behavior. As a result of the improved classroom behavior and stronger relationships with students, we would hope students would experience safer and more supportive school environments. Both of these program models may fall under a comprehensive school-based mental health model. However, the impacts of interest would be very different. In the first model, we may be focusing on measures related to anxiety, attendance rates, or school success. With the second model, we would be more interested in teacher stress and school climate. As you think about your theory of change, take some time to consider if and how you anticipate that school-based mental health services may lead to academic success. Mental health services are not directly related to academics. You're not teaching math or reading skills as part of these interventions. However, there is significant research illustrating that improved mental health does lead to improved academic success. How do you see mental health services and academic success connected in your school or district? Are you reducing the impact of depression or anxiety, making it easier for students to complete schoolwork? Are you increasing learning time by increasing attendance rates or reducing behavior challenges and preventing suspensions or expulsions? There are numerous pathways to consider, and it's helpful to know which are anticipated given the services that you are providing. If your school-based mental health initiative has identified specific goals related to equity, make sure that those are also clearly integrated into your theory of change. If you do not have explicit equity goals, now would be a good time to discuss this with stakeholders and to consider opportunities for your services to reduce disproportionalities in student well-being and to promote more effective supports for students. Integrating these goals directly into your theory of change will help keep the focus on your equity agenda, illustrate this commitment to school and community partners, and help guide strategies to measure your success in reaching these goals. Once you have articulated your theory of change, you can use it to identify potential ways to measure your outcomes. What are the outcomes that you hope to see based on your theory of change? Consider whether you have existing sources of information to measure impact. Schools and mental health providers collect a lot of information. If it aligns with your theory of change, you may have a good start in assessing impact. The comprehensive school-based mental health framework includes a number of best practice standards that should be incorporated into an impact assessment approach. One of these standards is that the impact assessment includes measures of educational outcomes. Educational success is a key domain of child and adolescent functioning, and especially important to measure and document when providing services and supports in a school setting. There are a variety of educational measures that could be used to explore impact. Depending on your specific theory of change, you could consider measures such as grades, attendance, absenteeism, or test scores. Another best practice standard is to ensure that your impact assessment framework includes social, emotional, and behavioral health data. Again, a variety of social, emotional, and behavioral impact measures may be appropriate. Sample outcomes include self-reported distress and well-being, office referrals, suspensions and expulsions, behavioral observations, crisis incidents, school climate data, or teacher well-being data. As you determine which outcome measures are the best ones for you to include, there's several things to consider. First, prioritize impacts that are most likely to be affected by your school mental health services and supports. Use your theory of change to help make this determination. Measuring potential impacts that are only indirectly or peripherally related to your services will not provide useful information about the success of your efforts. Second, consider whether your intended outcome measures are readily available. It may be efficient or effective to build on existing measures, so long as the information is accurate, high quality, and culturally appropriate. If existing information is not available, can it be reasonably collected? For instance, can your proposed impact measures be embedded into other existing data collection? The more complicated or cumbersome your impact measurement system is, the less likely that you'll be able to collect reliable and useful information. Third, consider what data are of the most importance to different groups, including students, families, school staff, policymakers, or funders. If you're proposing new data collection, you may need to engage these different groups to identify data that are useful for ongoing progress monitoring and program effectiveness. It is also important to consider whether data can be shared within and beyond the school team. Sharing information with core stakeholders is important in promoting transparency and building consensus. Not only is it important that information is meaningful to these stakeholders, but it is also vital that the information can be legally and ethically shared and that individual students cannot be identified in the data. Once you have selected your impact measures, you need to develop a plan to collect the required information. If the right kind of impact information is not already available, you may need to incorporate new strategies for gathering information. There are a variety of ways to do this. You could conduct surveys with students, parents, school staff, or other partners. While many people gravitate towards surveys as the way to gather additional impact information, it is not the only way. Consider including more narrative strategies, such as in-depth interviews, focus groups, or community discussions. While you may have a variety of information already available, it's recommended that you also include some of these more qualitative strategies, such as interviews or focus groups. These narrative approaches can be especially powerful in ensuring that students, parents, or others have the opportunity to directly describe their experiences and to share their perspectives in their own words in a deeper way than is possible through a survey. Many existing measures and data collection tools have been developed to meet the general reporting needs of schools or districts, and many have been designed through a generally Western or white cultural lens. These tools may not be useful depending on the cultural makeup of your school. As you design an impact evaluation approach, determine when you may need culturally appropriate tools or methodologies. Consider the needs of those that you want to include in the impact measurement and determine whether the existing tools align with their needs. You will need to select measures that meet the needs of populations who are experiencing health inequities, considering factors such as language and literacy needs. If you're not sure if available tools are culturally appropriate, consider engaging cultural brokers or other community members to provide guidance. Similarly, you may need to explore whether the available data reflects the real experiences of students and families, including those who may be experiencing health inequities, and determine whether other approaches are needed that better reflect those experiences. As you design your impact measurement system, consider measuring the long-term effects of efforts on health inequities, in addition to looking at shorter-term impacts or implementation issues. Schools and mental health agencies can be complex, with varying data collection mandates and multiple priorities to balance simultaneously. While they can be overcome with planning, there are a number of barriers that may interfere with your ability to collect and share impact information. First, data privacy laws or agency protocols may make it difficult to share information across systems, such as between schools and community mental health providers. Second, staff may have high workloads and limited time or capacity to take on additional data collection efforts. Third, it may be difficult to create technological infrastructure to manage your impact data efficiently and effectively. Fourth, staff may lack the knowledge, training, or time to create an appropriate data collection system. Fifth, often there's been a lack of parent, student, or community input into the evaluation system. The lack of input may mean that available measures are not appropriate for the student population or do not capture their real experiences or perspectives. Sixth, it may be difficult to find or create psychometrically sound and culturally appropriate outcome measures. Seventh, there may be a history of students or parents having negative experiences with data collection and or with their school system. These negative experiences can result in a lack of trust in the process and a reluctance to participate in additional data collection efforts. And finally, data collection efforts are typically designed to align with school priorities and legislative mandates. While these requirements are important to address, these priorities typically do not align with the lived experiences and priorities of students, parents, educators, or community members. As you think about your own school or district, what barriers do you anticipate in collecting or sharing data? What actions do you think could help address these barriers? All of these barriers can be overcome with thoughtful planning and partner engagement. A final design step is making sure that you have a data infrastructure in place. You will need to ensure that all impact data can be easily collected, analyzed whenever you need it, and easily reported. Before we move on, it's a good time to pause and reflect about your district's process for gathering and using student data to inform decisions about and understanding the impact of services and supports. There are a few different questions to consider. First, what are the key variables we should use to track the influence of our efforts, including specific impacts for populations experiencing health inequities? Second, what student information systems does your district currently use to gather and report on student educational and social, emotional, and behavioral functioning? Third, what improvements are needed to more effectively gather and use student data? And finally, what partnerships exist or need to be established to support your data collection efforts? We've talked about strategies for identifying and measuring program impact data. Having great measurement strategies will not be helpful if you do not have a plan in place for sharing the information with your core stakeholders and for using the information to guide improvements in your services or policies. Once you've developed a system for measuring the right impact data, you have the opportunity to use the data to understand what's working well and what is not, and for using this information to strengthen your school-based mental health services. The Comprehensive School Mental Health Framework also provides some best practice quality standards related to sharing and using your impact data. One standard focuses on the importance of disaggregating your impact data. To the extent possible, consider disaggregating data. Disaggregating data involves examining information for different subgroups of students, allowing you to see potential disproportionalities or disparities in your results. Your ability to meaningfully disaggregate data will depend on the size of each of the groups that you're looking at. Depending on your specific school population, you might want to disaggregate data based on race or ethnicity or country of origin, generation status, immigrant or refugee status, age group, gender identity, grade, geography, sexual orientation, free or reduced lunch status or other socioeconomic status indicators, or insurance status. If you do find disparities in data across various subgroups of students, be aware that there are many different factors that could contribute to these differences. There may be legitimate differences between groups based on different skills or experiences. However, differences can often be traced to other systemic variation in what students experience or how they've been treated. You also need to be aware of your own perspectives and opinions to ensure that you are not inadvertently interpreting differences through a lens of implicit bias. A variety of factors are listed on the screen that can explain some of the disproportionalities that you see, and it's recommended that you take a pretty broad lens in trying to interpret the differences that you may see in your own students. Another best practice standard from the Comprehensive School Mental Health Model is that the impact data that you collect should be used to develop recommendations to strengthen service implementation, improve access, and promote equity. Frankly, it's not worth the time or the effort to gather impact data unless you are going to use it to improve your school mental health services. As you review your impact findings, it can be helpful to create an action plan for using the results. Engage your school-based mental health team and community partners to consider questions such as, what did you learn about the strengths of your school-based mental health services? Where is there room for improvement? What goals do you have for improving, expanding, or sustaining services? As you identify your goals, consider what it will take to achieve them. Try to identify the steps that will be needed and how and when those steps should be taken. Who will be responsible for achieving them? Try to proactively identify barriers that you might encounter in reaching these goals and identify steps that you can take to reduce those barriers. You do not necessarily need to commit to large-scale changes in your school-based mental health system or services right away. You might want to test out some potential improvement strategies to see how they work. Consider developing a plan to conduct a series of iterative PDSA cycles in which you plan an intervention, implement it for a short period of time, study the results, and then act on what you learn from the trial. Our final best practice standard is to document and broadly report the impact of your comprehensive school mental health system. Reporting the impact of your comprehensive school mental health system can generate buy-in and support from diverse stakeholders, including policymakers and funders. Consider a variety of strategies for sharing your findings. Comprehensive school-based mental health requires partnership. Some partnership may occur within the school or district as different staff work together to design and implement services. There may also be partnership with external agencies and community partners who may provide guidance, offer services, or advocate for your efforts. To strengthen these partnerships, it's important that you share your impact information with others. Sharing your information promotes trust and transparency, helps support consensus building, and allows partners to use your learnings to strengthen services or supports. To support this goal, commit to sharing your findings, even if they are negative. Develop recommendations for your stakeholders to use the findings to support action. Use a variety of strategies to disseminate findings. Share findings in plain and clear language that can be understood by stakeholders, partners, and community members. and share lessons learned to help others concerned with strengthening comprehensive and equitable approaches to school mental health. In this video, I presented a brief overview of how to measure the impact of school mental health systems. It's likely you still have questions, and that's okay. This may be an area where you want to get some assistance from someone trained in research and evaluation methods. It is likely you would need to at least consult with others from within your school district. You may also want to consider bringing in a consultant to help. There's a robust community of individuals who provide this type of consultation. You could look for individuals through a local university or reach out to national or state level evaluation associations to find someone to work with you. I hope that this video was helpful in getting you started in thinking about an impact assessment framework for your school mental health services. Please reach out to us at the Midwest Center for School Mental Health with any questions, or if you wish to have any consultation in this area. Good luck. Thank you very much.